Hi there, you're welcome to RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos and contents here on our YouTube channel. And also you'll be able to help support our community here at RX Care. So let's talk about today's topic. So our medication of choice today is Amiodarone. So Amiodarone is a medication that's used in patients who have angina. It can also be used in patients who have atrial fibrillation, patients who have heart failure, myocardial infarction, as well as patients who have myocarditis. It can also be used in patients who are being treated for cardiopulmonary resuscitation, also known as CPR, as well as ventricular arrhythmia. So that's like an abnormal heart rate that happens. So this medication is usually dosed based on the patient's weight. So usually some patients may be on a 150 milligram, some patients may be on a 300 milligram. It really just depends on what the patient is being treated for, as well as the patient's weight. So let's talk about the medication dosage form. So this medication usually comes in a tablet. It can also come in an injection as well. So patients who are being treated for a CPR, most likely they're going to be getting an injection, and they kind of give them a loading dose and also load it down to give them like a maintenance dose to keep up with that loading dose in order to help with the treatment. So what are some of the side effects to look out for with Amiodarone? So some of the side effects include hypotension. So this medication can cause a low blood pressure in patients. So you have to make sure that you're checking your blood pressure while you're on this medication, and also reporting if you're seeing consistent low blood pressure. This medication can also cause increased sensitivity to the sun. So make sure that you're using a sun screen on your skin when you're going to be out for a longer period of time during the peak hours. Also, this medication can cause thyroid dysfunction. So patients may either get hypothyroidism or hyperthyroidism while being on this medication. So you just kind of have to make sure that you're getting regular exams when you're on this medication. That way they can check and make sure that you don't have that condition. Also, this medication can cause constipation in patients taking it, so make sure that you're looking out for that. This medication can cause loss of appetite. It can cause nausea and vomiting. It can cause something called peripheral neuropathy. This is when there's damage being done to like the lower limbs nerve, and patients start getting, pain or like a nerve pain in their lower limbs. And also this medication can cause dizziness. It can cause like a movement disorder. It can cause something known as an abnormal gait. It's kind of like affecting your walk, the way the patient walk after taking this medication for a long period of time. This medication can also cause something they call corneal deposit, which can cause some visual dysfunction or visual disturbance in patients. So what are some serious side effects that you definitely want to reach out to the doctor for immediately when you start seeing them? So those serious side effects include slow heart rate. So if you start noticing that your heart rate is lesser than 60, make sure that you're reaching out to your doctor and letting them know. That way they can assess and make sure that this is not relating to the medication. If it is, they can go ahead and stop that medication in order to avoid that side effect. Also, patient may also get congestive heart failure while being treated for another condition while on this medication. So you want to make sure that if you start noticing like a fluid build up in your body, maybe in like your lower limbs, make sure that you're reaching out to your doctor. Also, in patients who are having thyroid dysfunction while taking this medication, they might notice like, increase in appetite or loss of appetite. They might notice increase in in sweating. They might notice a decrease in sweating. It really just depends on what the thyroid levels are. So they can make sure you, as a patient, you want to make sure that you're going to your doctor for your regular visit and they're checking your thyroid function That way they can tell if this medication is affecting your thyroid or not. This medication can also cause a severe lower back pain. So if you start noticing this side effect, make sure that you're reaching out to your doctor immediately. Also in patients, it can cause something they call prolonged QT interval. So that's when you start noticing like an abnormal heart rate or heart rhythm. So make sure that you're reaching out to your doctor once you start noticing that. So who are the patients that cannot take this medication? So as a patient, if you have an iodine sensitivity or hypersensitivity, you cannot take this medication because it does have a iodine part to it. Also, if patients have like a 2nd degree or 3rd degree heart block, this is not a medication of choice. This should not be taken in those patients. Also, patients who have a cardiogenic shock, this is not a medication we would use, or a patient who have a decreased heart rate that's causing them to faint or causing what they call syncope, then this is contraindicated, which means you cannot take that medication. So what are other things to note while taking this medication? So you want to make sure that you're taking this medication consistently with food at the same time. So if you're taking it in the afternoon, make sure that you're sticking to your afternoon frequency. Make sure that you're taking it at the same time during that afternoon. Also, patients should also, like I said earlier, wear sunscreen when they're going to be out for a longer period during peak hours. That way, their skin is not getting burned easily. And also make sure that you're wearing your protective clothing if you're going to be out and about. Make sure that you're avoiding tanning beds, as well as this medication should be avoided in patients who are pregnant or nursing or breastfeeding mothers. So this medication is not a medication of choice because it may harm the fetus. So this is not a medication that you should be taking if you are pregnant. Also, this medication can cause infertility. So in patients who are taking this medication that are still of fertile age, make sure that you're taking note. You don't want to take this medication for a long time because this is a side effect that may possibly happen while you're on this medication. Also, like I said earlier, as a patient taking Amiodarone, you want to make sure that you're keeping to all your regular doctor's appointment in order to be able to get those blood work done and make sure that your thyroid is good, your liver function is good. Usually they'll do the liver function test every 6 months, while for the thyroid function test, you want to make sure that you're doing those every 3 to 6 months. All right, so this medication may make you dizzy, so you want to make sure that you're avoiding any activity around the time that requires your mental alertness, that it has a lot of drug interactions. So you want to make sure that you're talking to your pharmacist about other medications that you're taking from home in order to help avoid any drug interaction that might increase a side effect from this medication. Also, usually in patients that are using this medication for rhythm control, a rhythm control will be in patients who have atrial fibrillation. So another alternative, if you don't want to take this medication, is beta blockers, which would be like your metoprolol, in patients who are being treated for this condition. So make sure that you're asking your doctor about alternatives. If you hear about the side effect profile and you're like, no, I'm definitely not going to take this, you want to make sure that you're reaching out to your doctor and letting them know that you're concerned regarding the side effect. That way, if there's a substitute, they can substitute the medication for another medication that has a lesser side effect profile. But if the benefit of the medication in the long run does outweigh the risk, there's no harm in trying. All right, thank you. I hope I was able to help in terms of what to look out for while taking this medication. If you are using it for a condition, I hope this medication does help with that. So thank you for watching. If you haven't yet done so, please hit the like and subscribe button. That way you can help support our community here at DamiRx Care. Thank you and stay blessed.